everyone, I am Dr. Loveleena Nadir, a senior consultant at Rosewalk hospitals. January is the Thyroid Awareness Month, so let's talk about thyroid gland, its functions, myths and facts surrounding it. Thyroid gland is a butterfly-shaped endocrine gland which is present in the front of lower neck. It produces thyroid hormone, which helps the body to use up energy, stay warm, and also ensures proper functioning of brain, heart, and muscles. The thyroid gland increases in size and vascularity during pregnancy, and there is increased requirement of thyroid hormone during pregnancy. If there is excess of thyroid hormone in the body, it is known as hyperthyroidism. And if there is deficiency of thyroid hormone, then it is known as hypothyroidism. Now, untreated hypothyroidism in pregnancy can have negative obstetric outcomes. In a mother, it may lead to muscle weakness, it may lead to muscle cramps, anemia, placental abnormalities, placental abruptions, postpartum bleeding, and preeclampsia. In a baby, untreated hypothyroidism may lead to cognitive, developmental abnormalities. So it is very essential to screen all women for hypothyroidism during pregnancy. Also, women with autoimmune disorder, goiter, or pre-existing history of hypothyroidism must be screened during pregnancy. The way to screen is to do TSH, which stands for thyroid stimulating hormone. It is a hormone which is secreted by pituitary gland and ensures the functioning of thyroid gland. So as a rule, TSH, T3, T4 is done during pregnancy. Now there are a lot of myths surrounding it. So first is that if somebody has hypothyroidism, pregnancy is not possible. That is absolutely false. Subclinical hypothyroidism can decrease ovulatory function, but with proper treatment, pregnancy is very much possible. The second myth is that thyroid medication should be stopped during pregnancy. That is absolutely wrong, because thyroid medication has to be adjusted according to the levels of TSH hormone, and we have to maintain TSH levels below 2.5 mU per liter. The third myth is that there is no need of thyroid medication if the TSH levels are within normal limits given by any lab. Now that is absolutely false. If the TSH levels are more than 3, they have to be adjusted. The thyroid medication has to be increased during pregnancy to ensure that the TSH levels are below 2.5 in first trimester and remain below 3 in later half of pregnancy. Another myth is that soya products should not be consumed for people who have hypothyroidism. There is no scientific evidence which proves that. The only thing is that soya products may hinder the absorption of thyroid medication. So thyroid medication should always be taken on empty stomach the first thing in the morning. Then there is a myth that gluten-free diet can cure Hashimoto's thyroiditis, but there is no scientific evidence which supports that. Another myth is that thyroid medication is secreted in the breast milk and may harm the baby. Now, to tell you the truth, very little amount is secreted in the breast milk, and the dosage is always adjusted according to the hormone levels. So, one must continue with thyroid medication. In fact, the thyroid medication dose has to be increased by 20 to 30% during pregnancy, and ensure that the levels are within normal limits. That means less than 2.5 ideally, and one can ensure a normal healthy pregnancy if thyroid levels are in check. Thank you.